When you spend your whole life becoming a surgeon and then choose to walk away, you don't just change careers, you challenge a culture. Today's episode is part of my Disruptor series, where I sit down with leaders who refuse the status quo. Dr. Frances Mei Hardin takes us behind the scenes of her bold journey. This conversation is for everyone, whether you work in healthcare or not. Content warning. This episode includes discussion of mental health and suicide. Please take care of yourself while listening. And with that, let's just tune in.
Hi, my name is Frances Mei Hardin, and I'm an ENT surgeon turned writer and startup CEO. A lot of my work focuses on the hidden curriculum of medicine and also really the intersection between medicine and surgical culture, medical education, and media in all of its digital and written forms. I'm the CEO and co-founder of the Hippocratic Collective, a physician media company that has a network of phenomenal podcasts, a publishing imprint, several courses, and incredible in-person live events and experiences. I'm so excited to be here today to talk about my book, Surgeon on the Edge.
Welcome to Success Reimagined. I am Dr. Amna Shabir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. Dr. Frances Mei Hardin is an ENT surgeon, writer, and startup CEO whose work examines identity, ambition, and the cost of reinvention. A graduate of the University of Notre Dame and Case Western Reserve University School of Medicine, she is known for her unflinching commentary on medical training and her expertise in navigating the world of residency. Dr. Hardin speaks to a generation building lives defined not by a single path, but by possibility. She has recently launched her debut memoir, Surgeon on the Edge, and we are so excited to learn more about it in today's conversation and a lot of other pearls. Welcome to the podcast, Dr. Hardin.
Thank you so much for having me here, Amna. It's great to see you again and can't wait to get into it today.
Frances May, I've been dying to ask this question, so we're going to jump right in. You trained as a highly skilled surgeon. You're young, and you've publicly declared that you're walking away from medicine. That is bold. It openly breaks molds and challenges some deeply rigid narratives about success. Take us behind the scenes because I know high achievers in my audience, both inside and outside of medicine, are dying to know, where did you get the audacity to step away?
Yeah, that's a great question. And I agree with you. Like, I had never seen it modeled for myself. I, of course, spent years looking for every person I could find who left medicine prior to doing so myself. And so I've seen the full gambit of people who leave of their own volition, people who don't, people who finish residency, people who don't. Certainly there are increasingly mid and late career attendings who diversify and sometimes leave clinical medicine. I really never saw it in the early career attending of their own volition, finishing residency and then still saying, if this doesn't align, I'm not going to put myself through another decade of it. I think that for me personally, the audacity in large part comes from my husband. It really does. We joke all the time. If I had married a surgeon, extremely high likelihood that I would still be a practicing surgeon and or maybe divorced. If I was in or living in an environment that still drank the Kool-Aid, then I would probably still be drinking the Kool-Aid because I used to. My husband, he's in digital marketing and SEO. He worked in publishing at Ingram long before that. And even since our early days of being together, we've been together 10 years now. And by about year 2, I was telling him everything that was happening in the hospital, and I really think that he gave such a fresh perspective that was just of a really intelligent person who doesn't have any context for this, doesn't buy into it, and doesn't drink the Kool-Aid. And that had a really profound effect on me.
I am really nodding my head in agreement as somebody who has also had the privilege of marrying somebody outside of medicine and the impact that has on your personal well-being because I was raised in a dual physician household and leaving academic medicine or reinventing myself in entrepreneurship, whatever, it just felt so foreign. So I appreciate you openly accepting that and sharing that. And anyone who has met your husband knows he's quite amazing and remarkable. So a shout out to Colin for being mentioned right at the start of this conversation. But there has to be something from within, like, great, you got the courage from him and the ability to reflect and look like, yeah, this is not normal, Francis May. Like how horrible you are being treated and how you feel is not okay. So I'm not buying into it. What was it like for you? Because there's a lot of this internal angst, it's like this moral debt that needs to be paid, like every day, waking up and kind of like questioning yourself, is this the right choice? And then, of course, having the audacity and the courage to share it openly on social media, I think that requires a whole different level of internal grit. So I would love to know what
Mhm.
dialogues are happening in your own mind.
Sure, I will say too, yes, you're right, and of course, like, it's not even that helpful of a blueprint to be like, "Well, I'm just lucky. I married someone who helped me to see beyond drinking the Kool-Aid." But for me personally, I really did buy into all of those hardcore things about being a surgeon, and so had my training experience not been such a poor experience, the reality is that I was very suicidal as a PGY4 as a direct result of the work environment that I was in and had been in for years. I would truly say like conditions were bad, morale was low for many years before I was at the point where I was like really had plans and, you know, being put on suicide watch. So there is a freedom that comes from that. That's very serious. I take that very seriously. I don't say that lightly. Like when I share that, I feel like sometimes people, even people who knew me at the time and kind of heard some of the rhetoric I was using at the time, they were like, I thought you were kidding. I always thought you were funny. I thought you were kidding. Well, it doesn't have to be either or. I have kind of a dark sense of humor, but I would not kid about that type of stuff, right? So and I know I wasn't the only resident, even in that program at the time, who had, like, picked, like, which off-ramp of the highway they would wanna drive off of on the way to work, stuff like that. Like, it was very poor working conditions. But basically, there's a different version of reality where I die in residency. It really came to where it felt like about that point because I just didn't see another way through. But because I did get through and graduate and move on with my life, like I actually would think it would be appropriate to say a version of me or part of me died when I was a PGY4. And that impacts like all the decisions I made and even like the person I am post residency. Like I have, it sounds so cheesy to say like a second lease on life, but I do. I'm grateful to be here. I could have almost not been here. I am willing to let go of a lot of the trappings of prestige and academia because number one, they almost killed me. So that's a good reason to say, oh, okay, it's not that I'm really tough. It's not that I had such good perspective that I was willing to do that. Like it almost killed me. So when you get to that point in your relationship with anything, hopefully it makes all of us like kind of reevaluate. Oh, okay, this is not working and it is not working in a really huge way. The second part of that, in terms of deciding to share it publicly, yeah, it goes back to the fact that I know exactly, unfortunately, it's many years later. I still can access, I remember exactly what it felt like to just feel completely alone in training. Social media wasn't as big then. We didn't have other programs in our city, it was pretty isolated and more rural. We just felt completely alone, even when reporting concerns, wrongdoing to like institutions, right? ACGME, reporting them to heads of the department at every level. Like it was just not going anywhere. And I think that, again, my sense that that is just not right. I think every doctor deserves better than that, than kind of those conditions that we were offered. It was certainly not a learning environment. Very little learning went on. So I just think that yeah, I was driven to share this publicly because I think that people deserve better. I do think that institutional change is important. I've been to the ACGME HQ. This is all important, but I also know that institutional change is slow. Whereas a person being willing to put their face on a story and sharing it today, that's actually pretty fast.
Wow. I have so many thoughts going through my head. And it wasn't like when you made that announcement. I mean, some people had a lot of choice words to say under your posts on social media. How was that for you?
It was honestly totally okay. You know, it was a little surprising at the time. I'd never experienced it before. I had 200 followers on my private Instagram, so I literally have never seen a rude comment like on my posts. But I do believe, and I had a lot of great, friends and colleagues who have been through it long before me. Like, that is part of the nature of maybe having a public page and you put any POV out there. Like, there's going to be some nastiness that comes with it. But I will say, when it's just random people, they're clearly not in medicine. They're saying, well, you should have to pay the government if you want to leave. Those comments are like so off the mark and so random that they don't really bother me. I think that if any of the comments are hurtful, it's when it comes from like, there are medical students who say, you just couldn't cut it. You're just a loser. And that's so certainly what you're saying has no bearing on me. That kind of rhetoric, like, that is more hurtful. But I also get it because if I told myself 15 years ago, maybe some of this, I'd be like, this sad old person is talking all sorts of nonsense. I mean, I didn't even have a container to receive or learn from that kind of advice back then. I did not. I was very hard headed. And I see hard headedness out there sometimes, but I don't even, I feel like I really empathize and understand it. And I'm like, well, that's okay. Then you tuck this away like an acorn for whenever you experience this in training. Because most people experience the disillusionment. It's just a highly variable times. I had a wonderful medical school experience. I know many people who got wrecked in medical school, right? For me, it was residency. I know people who got all the way to their surgical subspecialty fellowship before they experienced that disillusionment. Because, of course, there's a lot of variable factors, including the person, but also that work environment, their rotation and hospital environment. But the fact is, now, when I zoom out and I look at it, that disillusionment tends to come for us all. And I've seen it in every format. I've seen it in late 40s surgeons where suddenly their practice is turned upside down. I've seen it in women in their 60s, their longtime physicians on the medicine side getting letters from the hospital, like, who are hospital employed. And it just says, if you don't see more patients, like, you're out of here. And this is for a long time, respected physician in the community and like veteran employee. So the disillusionment comes for us one way or another, I do think.
I have to agree with that very much because, well, medical school and medical training were rough. I am internal medicine and geriatrics by training. And I thought that I was going to graduate after my internal medicine residency and be a primary care physician forever and then basically die. Like that was like it. And then my disillusionment actually came during the practice of medicine very early in my career. I absolutely agree with it, with your assessment. And then when I went back to medical training for my fellowship, I had to like everything was different. And fast forward, I've continued to struggle with moral injury and stepped away from my clinical role, which was part time. And I stepped away last year for what I am calling for now a sabbatical. But it became unbearable watching my patients suffer, knowing that the care that they deserve and not being able to provide that despite being in a supportive practice environment. So it's amazing that there are these flavors that continue to resurface over and over again. So for anyone who's quick to comment, I really invite a lot of compassion to you for yourself and for the other person. Have grace and respect. But you have handled all the comments with grace and respect. So I appreciate you taking us behind the scenes and sharing a bit more about that. All right. So with that, we're going to move into the next question, which I've also been dying to ask you. I am curious about your relationship with perfectionism. Has it played a role in your journey and shaped any of the choices you made and the ones that you felt you weren't allowed to make at some point?
Yeah, absolutely. I think that it plagues certainly a lot of us. It's interesting because I don't tend to use the term perfectionism as much for it, but that's probably semantics. That's just probably on my end. I think that I've always had like a totally unnegotiably high bar for excellence, a standard that I hold myself to and everyone around me to, sometimes for better or for worse. Like in one sense, you could argue, and I think Colin would say that, you know, I make him better. And I would like to think like this is almost I grew up playing volleyball, right? So just you want to play to the level of like the best person on the team. But obviously on the flip side, and I've gotten to see this even now, as Colin and I work together, the flip side of it is that when I come to a business meeting or when I approach my work still with the ethos of a surgeon, which is that sometimes 2 days ago, I had a 12-hour straight meetings day. I don't take water breaks. I don't take bathroom breaks. Like, that is my own choice, and I'm kind of trying to unlearn some things, but it also is like, Colin didn't make that choice. He's not a surgeon. So even though I can have, like, high standards of excellence for those that I work with or, like, am married to in this situation also, it has allowed me to really reevaluate, like, even working styles. 'Cause it's funny, in surgery, you're just not really allowed to have different working styles. There's just, like, the heart of a surgeon, and that person does not take water or bathroom breaks. Like, that's the traditional but it's been this really wonderful invitation, I think, to just reevaluate and build by design, like, what I want to keep or not. But yes, there's perfectionism. I also think of it if we're gonna be more granular, right? So, extraordinarily high, rigid bar for excellence. That's one way I would think about it. Another way I think about it is like an addiction to external validation and prestige. Again, I don't think of it in terms of, I just don't tend to think very much, oh, am I perfect? Am I being perfect? I think that what's nice is that a common thing, common challenge, shackles that I see for especially my fellow women in medicine is like the people pleasing tendencies. And I do not have that. I think I'm very lucky. I'm lucky, but also if anyone knew me even when I was a kid, they'd be like, yeah, this kid really does not care about people pleasing. Like, I don't like this kid. But it has freed me from like a lot of that aspect of it in a helpful way. I think some of that's tied to neurodivergence and things like that, but I do not have an innate people pleasing tendency.
I am so intrigued by your comment and answer. Like, no one's ever answered this question in this way. And the way I've been reflecting with the work that I've been doing surrounding perfectionism, everything good in terms of the high standards, like, that's not the problem. That falls more in the domain of excellencism. And it's so amazing to hear you kind of answer that. But with perfectionism, it's like the performative aspect of it, the impression management, the fear of perception on how people are going to perceive what I'm doing. And it's very interesting to hear your experience with it. Share a little bit more about your upbringing culturally. Was there a component of perfectionism tying into the expectations part of it? And then, of course, with your decision to change career, walking away, how was that received by larger family? And because I know some people are really also wanting to know that.
Mhm. Yeah, absolutely. Oh, that's interesting. So with the definition you just shared for perfectionism, then as I kind of alluded to with the people pleasing, I almost don't meet that definition because I
Yeah,
I would
you're
say,
an excellencist.
yeah, wow, that's cool. Well, it's probably not great because again, that has gotten me into trouble at times, right? Like nothing, it's always the middle path probably. But in terms of perfectionism, I care about 0% about how I'm being perceived or if I am giving off the vibe of being perfect. I just want to be perfect. And in more of like a truer sense, and I don't care as much about like public perception. So I think that that's really interesting because I think that that probably links to, yeah, like people pleasing or wanting others to be at ease or something like that. And so in that vein, though, I think that I am a very close or direct product of how I was raised, which I actually think both of my parents, my dad was a lawyer and custom broker. My mom was a businesswoman in Shanghai. And then here in Chicago, she was a CFO for a company. They both, I don't think, were perfectionists in as much as caring what others thought, just highly intelligent people and had very high standards for themselves and everybody who was around them. And yeah, not again, like none of this being performative though. Like it's not performative, it's just genuine skill and expertise and talent, or people don't have genuine skill and expertise and talent. I lost my grandmas who helped raise me. I grew up with two parents and two grandmas as an only child. And I lost my paternal grandma, Ma, at about, I was age 16 or so. She was 86, and it was pancreatic cancer, stage 4, that we diagnosed when I took her to the ED for, this persistent abdominal pain, nausea, vomiting. So we lost her. And then just a few years later, my dad passed away when I was 20 and he was 60 of sudden cardiac arrest. And then a few years after that, we lost Abu, my maternal grandmother, to a really protracted course of like Lewy body dementia and hospice caretaking in the home. And Ma died in hospice at home. And then, yeah, took care of Abu for many years. My mom was her primary caretaker. So to answer your question about like perceptions from family, permission I needed to get from family, because yes, I do care a lot. And I do think it's important, like as an Asian woman, like as a Chinese woman, when my therapist used to tell me, well, you just have to, you just got to do what's right for you. You just got to do whatever you want. I would be like, you obviously don't understand, Asian culture. And I don't necessarily want to do that. I don't think I can do that. But that being said, I was able to really change my relationship with myself and even with like parental approval. My mom's my only blood family, essentially. I didn't grow up with cousins or anything like that. So I just have my mom. And what's been wonderful is that she is incredibly supportive of everything I'm doing now. I mean, she's the biggest fan of the Hippocratic Collective. She's going to be at my book launch release party in New York City. She is absolutely here for it. And I think that that is a really beautiful icing on the cake and surprise, right? Because essentially I had to do a lot of therapy and a lot of work to get to the point of where I say, respectfully, I'm 33 years old. I'm very grateful for everything that the family invested in me, that you invested in me. I do need to leave this career and change careers for myself. And I'm going to be okay. I have to be okay whether you support that or not. I would obviously, like, your support would mean the world to me. But if push came to shove, which it did, I need to be okay either way. Well, what's really wonderful in my instance is that our relationship is the best it's ever been. I no longer have like resentment about my profession and showing up to a job that I do not like, that was a job, that my parents liked every day. I think that it's just been very healing for all involved. It's nice. I mean, and I know that none of us can have like that guarantee, but I'm so fortunate. I feel very blessed that like things are just the best and we have a shot at something much more real and peaceful than we ever did if I stayed in that career.
I want all the high achieving parents in the audience listening right now to really focus on what Frances May just shared with us, because that's going to lead me to the next question. Because this conversation is not just about what you have had the courage to leave behind, but also the incredible things that you have created. Like, it's not that you walked away and then you've been sitting. You co founded the Hippocratic Collective. And I have to say, I loved the launch. It felt so intentional, so disruptive. A lot of change makers tune into this podcast. What are you trying to accomplish with the collective? Share a little bit more.
Sure, yeah, it's a physician media company, and that decision was very deliberate because essentially inspired by the Peter Drucker quote, culture eats strategy for breakfast. We talked about there are strategists, there are decision makers and policy holders at institutions and things like that. But I think we can all look at the 80-hour work week and duty hour policies, and then the fact that I myself have experienced, and so many people I know, right, just lie on your hourly log. So this goes back to that core culture eats strategy for breakfast. So even as we implement like positive protections, great new policies for our physicians and for our trainees, things like that, there's an element of, well, if you haven't gotten the culture piece sorted out, then no one's going to enforce them, right? And so we're a media company. We have a great breadth of offerings, including a full podcast network. We have a publishing imprint. We do in-person experiences, brand collaborations. There are courses as well. And it's really been phenomenal. It's been wonderful. And it's so important. HC has already succeeded in that it is its own distinct brand. It's not It's certainly not my brand. It's not another co-founder's brand. It stands on its own. And even further, the diversity of physician personalities that are platformed across all of the offerings, that's really important because of course, like not everyone is ever going to resonate with just one doctor. Like we want people who look or speak like ourselves, and there's a very diverse amount of like personality there. So that certainly those with gentler spirits, 100%, they might not resonate with my stuff as much because as a surgeon and somebody who survived like the surgical culture, it is pretty effective that I speak the in-group language and I almost have the aggression and confidence of a surgeon, right? So I have the confidence and aggression of a surgeon, but I choose to use it to wield that in a different way, which is to question traditional, outdated, harmful, mutually harmful, like lose-lose aspects of our culture that we imbue the next generation and the next generation of surgeons with.
I really enjoyed the energy that you've created with the collective. And it's really infectious whether somebody is looking, there are different things that we're all looking for in and outside of medicine. And to get that collective energy, I think that's pretty remarkable. So power to you for doing that and like starting this spark. Cause I know way, way back a couple of years ago, we had some conversations and then you executed. And I think there are a lot of people among us and physicians that have ventured into entrepreneurship who will sit and they will talk and they will talk some more. And then they will carry a lot of this agony of like, I want to do this, but then I have all this other stuff. You actually cleared the noise and you went forward with it, which is remarkable and very, very like, I really want to celebrate that. And with that, I also want to celebrate the amazing focus of today's conversation, which we are about to go to. You recently published your book, Surgeon on the Edge. The title alone, I'm going to say, is arresting. I love the cover. I love the color combination. So beautiful. And it's not just, and I totally did judge it by its cover. Who is this book really for? And why should every high achieving person, whether they're in or outside of medicine, they should read this?
Yes, thank you so much. And I do appreciate that. I do believe I've always been the type of person where I don't like to talk at length about things. I don't like small talk and I don't like hemming and hawing, and I rarely do those things. Like that's just true across all domains. And I think I bought the first house that I saw more than once. Like just because if I'm already looking at the house, that means that I had great interest and had already researched it thoroughly, right? That's not like a carelessness. If anything, it's just being really thoughtful and careful in a way that's congruent with my values. So anyway, I really appreciate you speaking to that. And I think that you have, of course, done the same thing with everything that you've built. Like it's really fun for us to connect after more than a year, and we were earlier on in our journeys when we last connected. For the book, I agree with you. This was never meant to be. This is not just for doctors. Even in the general population, people who like to watch The Pit, this is a great kind of companion text from a real life surgeon that does have even some of those more action packed scenes, right? Like there's an emergent slash trach, and that dovetails really nicely with some of their cases, including like in season 1, episode 5, they have a tonsil bleed emergency through the ED. Um, this book is for anyone who is a doctor, wants to become a doctor, knows a doctor. And the reason that it kind of broadens like that is because not only are there people out there who are interested in healthcare stories, but there's a real patient and patient family aspect of this to where people want to know what's going on behind the scenes and like what's going into their care. I think that increasingly in these times, patients are noticing the vibes are off in here. Like I went and saw my doctor, my surgeon was mean to me. I used to have patients here in my practice and they would come to me for a second opinion and say, that last ENT, they were mean to me. They were rude to me and my family. They were curt, definitely didn't seem like they cared at all. And they blew me off, right? Like these types of stories and interactions are more and more common. So I do think that the absence of physician wellness and a bad culture that like harms its physicians, that's not just a physician problem because it's becoming a patient problem. And patients and their families, like, I think can sense that things have been going on behind the scenes. It's just that up until social media, doctors and medicine and surgery did a really good job of keeping it just secret. I think that there's been a lot of this problematic culture for many years. But for instance, like my book is a willingness and a desire for me to just go first, right? Lay it all out there. This is not saying that this is a perfect run. This is not how a really cool and smart person maybe would have like navigated all this. It's not that. It's really not a story unlike other physician memoirs, which are sometimes like a very long pat on the back of myself. Yes, it was hard, but of course, of course I did it, and now I'm at the top, like little old me. I have read many books that gave like really that impression, and this is a true departure from that because this is a literary nonfiction memoir. The people who taught me how to write are not in medicine. I deliberately did, again, a lot of research on different MFA options, writers groups, but my writing mentor was Neil Strauss, a person who I respect hugely and I regard as one of like the great writing voices, especially in literary nonfiction. And so there's a reason why I gravitated towards that style. And I do hope that people can see like that influence from early readers, people who have already written their blurbs and things like that. Like they do see that Neil influence and style. And what I think is wonderful about that is just that the more that we do interdisciplinary work, then the better art I think that we can put out. That's also a reason why at the Hippocratic Collective, like our executive producer is out of New York City, got her start on MTV production 20 years ago. You know, these are like seasoned experts. I don't think that my book would be anything like what it is if I had learned how to write from doctors.
I am allowing myself to soak in your answer because there's so many things that have resonated with me, including when we, first of all, talk about clinician well-being, physician well-being, surgeon well-being, it's ridiculous that we untether it from the well-being of our communities that these clinicians and physicians serve. And that's kind of the way we have using those perfectionistic narratives almost like dehumanized. I absolutely look at physician and surgeon well-being and our clinician well-being, healthcare worker well-being as the well-being of the patients and the community at large. So I'm so glad that you pointed that out as well. Second, absolutely, you're talking to the pros. And I feel that when we're doing creative work, it is so healing to actually step away from personally. The reason it resonates so much for me personally is because I've sort of done the same thing in my healing journey, whether it's creativity, whether it's the podcast, everything. I like hung out with non-clinicians and people who were able to, they're just, first of all, telling me, like, no, this is not okay. Not just my husband, like other voices in terms of all the things that I'm questioning, having these internal narratives, but then actually going to the professionals, people who are dedicated to art, media, literature, like who are actually doing the thing. So that's incredible. I had a sneak peek at the book. I have started reading it and I'm hooked already. Even just the page of contents, I picked it up and it was not like your traditional memoir. I definitely felt that energy, just the dedication for the book. I mean, I laughed when I opened the book. So really encourage our listeners to buy it, to read it, to share it. And all the links for that will be in the show notes. Absolutely. Frances May, I know we've touched a little bit about breaking traditional molds of success. If I was to ask you this question at this point, how have you reimagined success for yourself?
Yeah, I've totally, totally overhauled my definition there. Now, having a regulated nervous system, being able to enjoy being alive, that's newly included. You know, I never thought about my nervous system for the past 15 years. And that was definitely to my own detriment. I just kind of thought, I feel bad all the time. And that, yeah, I kind of ignored a lot of bodily and psychological cues. But for me, success is really newly defined as financial stability with a regulated nervous system. And then also, again, as a cherry on top, like being able to work with people who I really respect, who share the same values that I do. That's a huge privilege. You don't always get that in the hospital. I know what it feels like to not have that.
The regulated nervous system and the dysregulated nervous system got me again because I was instantly reminded of my reaction if a beeper goes off somewhere, even in the distance, and what that
Yeah.
does to me still.
Like in a restaurant. I know. I'm always like, turn your cell phone off. We're eating here. Stress me out.
For our audience members listening, what is maybe your one main take home point?
So I do think like the main take home point from the book, really like the elixir for the whole story, is self knowledge. I think that anyone who reads the book, they'll see it's framed as a catabasis, a descent into hell, kind of like Dante's Inferno style, and the uneven climb up out of hell via hypnosis. But at the end, a person with very little self knowledge gains that and then thereby kind of can unlock the rest of her life.
So powerful. I know that our audience members would love to connect with you and support you, your incredible causes, the collective, and of course, buy your book, Surgeon on the Edge. So tell us all the places where we can connect with you.
Awesome. Thank you so much. Please feel free to connect. I'm on Instagram at Frances May MD, on TikTok at francismay.md. I'm on LinkedIn as well. And you can check out our websites at hippocratic-collective.com and francismay.com. Surgeon on the Edge is available for ordering on Barnes & Noble and Amazon. We're also going to, of course, be selling copies at all of the stops along my upcoming book tour.
This has been an absolute delight. Thank you for your time today.
Thank you.
You might believe you don't have the time or energy to focus on yourself, but this is exactly the right time to get serious about your well-being. You don't have to do it all alone. I'm here to help. If you enjoyed this video and are ready to take the next step, head over to dramneshabir.com where you'll find free resources you can access right away. The website link is below. Let's get started on your path to thriving.